Hi everybody, I'm Laurie Cadden, and we are here at the wonderful, I can say that, doctor, the wonderful Scranton orthopedic specialist. With me is Dr. Timothy Seebecker, DPM, or Doctor of Podiatric Medicine. God, I said DPM. I didn't miss it up either. I said the name right. I said, Tim, I'm going to call you a family from West Side, the Beeseckers, and he's Seebecker, so we got it right.
You got it right.
So anyway, we're here. This is the third series of this year. We've done a whole year, and we're starting this year with our third. It's Lackawanna County Medical Society's Public Health Education Series, and you're lucky number 3. How about that? So we're here to talk a little bit about foot and ankle health. Lots of crazy stuff goes on down there between the ankle and the foot, and they're one connected. I feel like singing that song, the shin bone's connected to the, because it really is true, isn't it?
It is true.
Everything just gets connected all the way out. So tell me, what are some of the most common foot and ankle problems that you see?
Here at Scranton Orthopedics, the most common thing I see are injuries, and a wide variety of injuries, from fractures, which are broken bones, to tendon ruptures, to sprains, all types of injuries. That's our most common.
Okay, so if it's injury, so what is it that we can do? I know there's basic stuff, but what is it that we can do to really protect our feet and our ankles? I know injury, sports, is that pretty much the most a sports injury? It could be just any, like a trip and fall?
It can be any source of injury.
Mm-hmm.
We see a tremendous number of people in the winter who slip on the ice.
Right.
So your basic safety issues are probably very important to help to reduce those types of injuries.
Mm-hmm.
In the summertime, it's the wet grass that seems to get people. They're out being active, doing all kinds of summer activities. So basically, safety issues, I think, are the things that people can do.
And such as?
Avoid scatter rugs in your home, those types of things. The stairs are a very dangerous area.
My mother fell down one step. She didn't fall. She missed a step.
Correct.
And broke her ankle. Dr. Schmaltz actually
will
did.
say to people, if I had a nickel for every person I saw who was carrying the laundry down the steps and thought there was one more step.
Yes. Exactly. She had
because they have the basket in front of them.
You can't
see. And next thing you know, they're at the bottom of the steps.
Right, exactly. It was only one.
Those types of things.
That's
simple things.
Freaky, though,
simple
when you think, it is so simple. So even though you really have to be cautious, I will tell you what's been happening with me. We can say this because this is Scranton Orthopedic. I, of course, have and I know it's because I've self-diagnosed, torn meniscus in my right knee. Now, it hurts, but as they say, you don't get anything done until it's really, really bothering you. Now, it's 3 years. But I find that I'm much more careful in how I walk because of that. Yeah. So it almost, I look as an aid to not doing crazy things for injury purposes.
Made you aware of it.
It has.
Yes.
I'm much more aware of where I walk, how I walk, what I have on, and how to get to where I'm supposed to be. I'm much more conscious of that.
I'll have patients tell me every day after a fracture or a bad injury, they're careful after because they're aware of it.
Right. So that's not unusual. That's what happens.
Very common.
Okay. So see that's the beauty of, I'm very honest, I told you as we sit here again. And you know what I have to say, it was so cute because I'm a mom of 2 sons. So doctor said, would you like to sit so I don't, and I'm sitting. I said, no, I like it like this. He said, it's just I'm thinking of my mom because she taught me to be a gentleman, and I love that because that's my boys too. I say the same thing. So thank you for that. So what precautions do you need? What other things can you do, like to take care of your feet? They're so often neglected, aren't they? They're the part of our body, I think, that people just don't want to bend down and do it, or they don't like the toes, or it gets scaly and all that stuff happens. What is the best way to protect them?
Basic hygiene is probably the most beneficial thing for patients. Lotions and creams on a daily basis to try and keep the skin soft and avoid any type of skin aggravation or irritations.
And so then when you're taking care of your feet, I, every day, in my shower, use one of those kind of things around my ankle. I try to make sure when I get out of the shower, I wash, my toes, because I think people don't pay attention to that. They take every ounce of your weight and then some all day long between the shoes we wear, what we have on, the elements. We're trying to battle, walking on weird things sometimes. The best way then to do it, should people do things like that in the shower? Is that the best time?
Yes, yeah? Basic hygiene. It really becomes like any routine hygiene activity. It's like brushing your teeth every day. It has to become part of your routine. And once it is, then it's easy to do because you do it every day.
So do you think women, and I say this because I think it happens because of sandals and stuff, do you think women's feet by nature are drier than a man's foot? Because I know this is weird, but I do look at that because I think every day I'm in the shower making sure I'll show you them later, but the bottom of my feet are all, scrubbed up and looking decent and lotioned. And guys seem to have naturally better feet. Is it because they don't? Mark's shaking his head. Yeah, he's agreeing with me, and you're agreeing. Is it biological or just because they don't wear sandals as much?
There's no evidence that men and women have difference.
But you see it, I bet.
We do. We
see?
do.
I'm just making this up now, but it is true. I noticed that.
Yes, it is true.
Okay, so I guess we got to wear less sandals or whatever we're doing. But tell me, you exercise your body, you do all the, as much as you can for every other part. What about the feet? Are there ways to exercise and to help your feet?
There really aren't exercises for your feet. Again, the hygiene issues are probably the thing that the individual patient can do to try and provide some preventative efforts for themselves.
So this is the $1,000,000 question. Shoes. Now you see what I have on, right? They're not bad. They're right in the toe. They're easy. They're low. They have a little tiny heel. What women who wear high heels, and God knows I'm a victim. For many, many years, I wore those tiny little, pointy toes and high. What is the deal with them? Does it really kill your feet?
No, they're not designed for comfort.
No,
they're simply not. It's very common for me to see a woman who will tell me, "Don't tell me it's my shoes because I always buy the most expensive shoes."
Right.
And the dollar figure that's attached to them has nothing to do with their biomechanical qualities.
Is it because of the way they are? So
your weight is up on the forefoot, up on the front part of your foot in a heel.
Yeah.
Your weight is focused there. Your weight is not designed to be focused there, but in that shoe it is.
So how is your weight supposed to be? Evenly distributed?
Yes.
And what about people who are flat-footed? Do they have worse time? And
Yes.
Yeah.
Overall, yes.
Just in making sure their muscles and bones are in alignment, or injury prone, or what?
All of that.
Really?
Yes, all of that.
Now, my son's doctor, when they were little guys, we lived in Philadelphia, and he went to a doctor, I loved him, at Dr. Favor, and he said that, and both of my kids were slightly, they aren't now, but then they were sort of flat-footed, and he said to me one time, "Don't worry about it, they make the best athletes." Now, my kids aren't athletes, but is that true? Did you ever hear that?
No, that's probably not.
It's a lie,
That's probably not accurate.
Come on, Tim.
Most of the great distance runners
Yeah.
are slightly flat-footed.
Yeah.
And most of the sprinters are slightly high-arched.
Okay.
So, if you we're in the Olympics right now. So
Yeah.
if you watch the finals of the 100-meter dash, there'll be 8 tremendous athletes lined up, and they're all physically about the same. They're all about the same height, right? They're all about the same weight. You won't find one guy 190 pounds and one guy 110 pounds. I mean, you won't have that kind of disparity. So there are some physical similarities.
Well, tell me then, is there an issue because you're flat-footed? Is there an issue if you're high-arched as well?
Yes.
Or not?
Yeah, there are certain issues that, pathologies that we see, complaints that we see, that are more likely in those patients, but it's
Okay.
not exclusive to them.
Okay.
So it's not as though if you have a certain style foot, you're condemned to have a certain problem.
Right. So tell me then, if women, you're not going to say they shouldn't, but really it does wreck the way their feet. Tell me, what is the best type of shoe to wear?
The qualities of a good shoe will always be the same. And that's
Okay.
a stiff midsole. The stiffer the shoe, generally speaking, the better because it's more stable. A stiff heel. So if the part that comes up around your heel is real floppy, like the old Chuck Taylor Converse sneakers we used to wear when we were kids,
Yeah,
those
I
are
love
not the
them.
best.
No.
We all love them,
Yeah,
but
they're great.
mechanically they're not very good.
Okay.
And those are the qualities of a good shoe. And adequate room in the toe area. It's
Okay.
always fascinating to me to see a lady who comes in and says, "Don't tell me it's my shoes." And we'll put her foot on a piece of paper and trace the outline of her foot, and then we'll put the shoe down.
Yeah.
And the shoe is about 4 sizes smaller than the foot. And that kind of should end our discussion about shoe
so
size.
who's right and who's wrong?
Yeah, I'm not trying to create an argument.
I'm teasing, but I
that's-
know, I get
yes,
it.
that's the issue. That is
So
oftentimes the issue.
you prove it.
Well,
And
it's
then do they say-
irrefutable.
I know. They know anyway.
They know.
The women
That's
know
right.
because when you're putting it hurts. I love them and they look great on your leg, but they're tough. So if you have, and I know all these things out there, so many shoes say they're all the different names, that the middle part has the arch in it already, and all of these things. But tell everybody, what is the difference between an actual shoe insert and what an orthotic would be?
An orthotic would be custom made for that individual.
Okay.
A shoe insert you can get
anywhere.
You can get at any store that has 50 pair of shoes on the wall. And we've all been to the sports stores that have a variety of shoes on the wall. And they'll have all types of inserts for the shoes. And those are fine. But an orthotic is a prescribed device that is made for a certain pathology.
And what is that? Why would someone get that?
Oh, there's a wider range of foot
Reasons?
Disorders that would
Like a fallen arch?
That's right. That can benefit from an orthotic.
Okay. And so when someone gets them, then do their shoes have to be specially made, or are they made to go in almost anything? Or do you have to wear those clunky?
They will usually go in just about everything, but not everything. So if you have a pair of shoes that's a little bit too tight now, an orthotic in that shoe is not going to help that problem.
Okay. So it helps the foot. It doesn't help.
That's correct.
The
It doesn't
shoe
help
or
the sizing.
Okay.
That's right.
And so what are other things, doctor, that would actually cause a foot to be deformed, or an ankle, or any issue with that
There are
area?
literally dozens of etiologies or causes to foot deformities. Things like tendon ruptures, injuries, fractures, a whole variety of things.
And tell me then, the ankle is connected then to all of those bones, and there's how many bones in the feet?
There's 28 bones in your foot.
And that's in each toe and all?
In each foot, that's correct.
Okay.
Each foot has 28 bones.
And in the ankle, how many bones?
Well, it depends on what you define as the ankle, but about 5.
Okay. Why? Tell me the difference of what you define as an ankle.
Well,
That's interesting.
This becomes a little bit technical.
Okay.
But the Europeans consider the ankle to be the ankle joint and the subtalar joint. They work together as a unit.
Okay.
In America, we call the ankle joint the joint between your tibia and your talus. So
The talus is that back?
the talus is the bone inside the ankle that rocks up and down.
Okay.
It's shaped like a cylinder.
Okay.
So really, the terminology can become a little bit tricky sometimes.
So many complications with the feet and the ankles and twisting them. And what about a sprained ankle and all those? Is that all that really, when that happens, you're like, thank God it was just a sprain? But that, or ligaments torn and all that, do they always require that, like, surgery, or sometimes can they or not?
I hear that all the time.
Yeah.
Would I have been better off breaking it, or what's better to have, a sprain or
Right.
a break? And a sprained ankle is the most common musculoskeletal injury that we see. In the entire musculoskeletal system, it's number one. It's number one by a mile. It's an injury to the ligament structures of the outside of the ankle. And its treatment and its outcome really depend upon the severity of the initial injury. We've all twisted our ankle very simply and never had to see a doctor, never had to go to the emergency room, and jump and think, oh, thank God I didn't do worse than that. And then you'll see sprains that can take weeks, if not months, to heal. So there's a wide range.
So it depends on what you
Depends on the
actually
severity of
hurt.
that.
Okay.
And it depends
okay.
upon the individual patient.
Okay.
So the same injury in an 18-year-old young lady and a 90-year-old lady are different.
Okay.
Even though it's exactly the same injury, the prognosis there is different. So the individual makes a big difference there.
And does it depend on their threshold of pain and what they can tolerate too? I mean, if someone says, the heck with it, I'm not going, I can deal with this.
Yeah,
some people say, I'm going. Does that matter at times?
To some degree it does.
Yeah.
To some degree it does.
And how it heals too in
Yes.
that process. So then I'm sure, because I hear this all the time, that people who have plantar fasciitis, did I say that correctly?
You did.
Okay. So when you have that, people, I can see, because you can tell how someone gets up and they walk and they'll say, I've been diagnosed with this. Could you tell everybody what that is? Also, while we're on that subject, the bunions and the calluses and hammer toes and all those kind of things that are related to the foot. Let's talk a little bit about that.
Well, plantar fasciitis, we mentioned earlier that ankle sprain is the most common injury. Plantar fasciitis is the most common complaint. And plantar fasciitis is typically, can be seen in anyone, typically an adult, unusual to see in a child. Begins with pain in the area of the bottom of the heel. And most people will not have a specific history of injury. So when I ask them, what'd you do to yourself? They say, I don't remember doing anything. It just started to hurt me.
Is that a telltale sign that's what it is?
Well, that's one of the signs in the history that triggers your thought process for plantar fasciitis. But they will tell you, when I first get up in the morning, I'm a little old lady. I'm hanging on to the furniture. Once I get going, it will ease up for me. But then it will bother me again during the day, and it can really become very debilitating.
What is it though? Is it
it's an inflammation of a ligament on the bottom of your heel.
And what is it caused from?
Nobody knows.
No?
Nobody knows.
Because people
and it's
always...
probably not the same thing in everybody. It may be different in different people.
Okay. All right. So tell me then what you would do, what the treatment of bunions and calluses are. Is there a treatment for calluses? Bunions I know, but do you treat that?
Bunions?
Callus, I know
calluses,
bunions.
yes.
Okay.
Calluses are a thickening of the outer layer of the skin, and they can usually be treated very effectively with simply trimming them down.
Okay.
They will oftentimes reoccur. That's the natural history of it. They're caused from friction and pressure.
So shoes.
Shoes. We're back to shoes.
Wrong
That's
ones,
exactly
yeah.
right. Back to shoes. You had asked earlier about shoe inserts. Those are oftentimes patients who an over-the-counter shoe insert is a cushion type insert is a very good option for those patients.
Okay.
To help to lessen the trouble that those things give them.
And what about those little, little pads and things? Do they actually help? Do they work?
They will. They help the vast
Temporarily,
majority
I
of people.
guess,
That's right.
right?
That's exactly right.
So,
the problem in my world with anything you put in the shoe is anytime you're in a shoe that's already too small, and now you start sticking other stuff in there, you're taking up all space that you don't have. So sometimes you can work against yourself with that. But oftentimes that's a very helpful thing for people.
And I know you do, because my dad was a diabetic. We talked about this. He used to go, and I used to trim his nails all the time. And then when he got older and his diabetes got worse, I never would. That's also things that you do in your profession is to help, because it's so important. What is the reason for infection that you don't cut them?
It's
or
preventative.
Preventative.
It's preventative.
Okay.
There's nothing more discouraging to me than to see a diabetic patient who has wounded themselves. Not meaning to, an accident.
Right, because of trying to do that.
Combination of they're not as agile as they used to be, so to physically get to their foot is harder. Maybe their eyesight is not as good as it once was. Their grip strength is not as good, and they're kind of fishing around and hurt themselves. And then it can become a real problem for people. So we'd like them not to do that.
So it is something you do though, because I know people say, and I said that to my father. You go to the a doctor. He said, yes, that's what they would do. And I said, wow, that was. I mean, here I am thinking I had to do it for the rest of his life. I said, okay, well, this is good because it made sense.
The problem that we're beginning to encounter and have encountered for years is that many of our insurances and Medicare don't want to cover that service. Well, so that becomes a little bit of a...
And you can understand that, but my
that
God,
becomes
the feet are the first thing to be affected, not in the eyes, but the feet with the diabetic. And you would think that would be a form of preventative medicine to help them.
I'm in your corner on that one.
Yeah, so we'll get after that insurance group. So tell me then, a hammer toe. Tell everyone what that is and what you do to treat that.
Hammer toe is a deformity of a toe where it contracts upward, and the reason
on any toe.
It can be on any toe. Can be on any toe. And it will typically rub in the shoe, because as it starts to become deformed, it no longer fits in a standard shoe. It'll start to rub in the shoe, and that will produce friction and callus formation, and oftentimes an ulceration or an infection can develop from that. So that's why hammer toes are problematic.
So they can be corrected
they
though?
Can.
Okay.
They can.
And then when, does that often happen because of an arthritic joint? Are they similar to that as to what happens?
Not exactly similar. Similar, but not the same.
But you do see arthritis in the toes, right?
We do.
And how about the ankle and stuff?
Arthritis can affect any joint.
And especially if you had an injury in it before, it goes right on getting you, right? It goes right there.
Pre-existing injury can predispose you to those problems.
Okay. So anything else you would like to tell our viewing? One time I said the listening audience on my radio. I said the viewing, and to our viewing audience, would you like to tell them anything else about protection and taking care of your feet and ankles?
Just, I think the safety issue in my practice would be the biggest thing that I see.
Pay attention, right?
Just be careful. Just be careful. These injuries occur in the blink of an eye.
Right. Freak.
They don't get better that fast. They can be months and months and months in some cases. Before people return back to their previous level of activity. So prevention is really the key.
And I have one question before we leave. Are you a runner?
I used to be when I was young.
Do you see a lot of, when we talk about that, because one day we had two doctors on, and one was like pro running, the other said I would never do it. So what's your take on that?
I think running is fine.
Okay.
I mean, I would never discourage.
Again, be very careful with that.
Correct. That's like with anything.
The right shoes, making sure.
And from an activity standpoint, you should obviously, if you're a runner and you participate in a sporting activity 3 times a week, you should have a special shoe for that. So if you're a runner, you should have a running shoe. That just makes sense.
Okay. Well, thank you very much.
You're very welcome.
Good to meet you.
Nice to meet you.
So we were here for our third segment of the Lackawanna County Medical Society. Public Health Education Series. Tim did a good job with this. Dr. Tim Biesecker, Seebecker. See? What did I tell you? Now I got through it all.
You knew you were going to do that.
Tim Seebecker.
That's correct.
Tim, you're a good sport. You're a good guy. I like it. He's with Scranton Orthopedic Specialist. Thanks for joining us today. We hope everybody listens and watch and pay attention to your feet. Take good care of them and pay attention to your surroundings so you don't get hurt and you have to come and see this guy. So please take care and thanks for watching. Next month we will have a series on immunizations, Tim, on children and adult. So that'll be very interesting and all the controversy and all the stuff that lies with that. So thanks for watching. Have a great month, and I'll see you next time. I'm Laurie Cadden.